The Ministry of Health, Wellness and Elderly Affairs recently launched its Vector Awareness campaign under the theme Stop the Spread, Controlling Vector Starts With You. The campaign aims to strengthen the country's action to combat vector-borne diseases through public awareness, community engagement, and activities. Some of the vector-borne diseases are dengue, chikungunya, Zika, yellow fever, and leptospirosis. The Vector Awareness campaign will roll out with activities such as roadshows in communities, drum-covering workshops, children's summer camps, continuous school education sessions, targeted surveillance, and simulation exercises. Chief Environmental Health Officer Cheryl St. Romain reiterated the need to safeguard the health of the nation and the need for society on a whole to play their part in controlling vectors.
This campaign is not just another health initiative. It is a call to action because effective vector control is not solely the responsibility of health authorities. It requires a whole of society approach, from households to schools, workplaces to local councils. Each of us has a role to play in eliminating breeding grounds, promoting awareness, and adopting safe and sustainable behaviors.
Chief Medical Officer Dr. Sharon Belma George applauded the approach undertaken with the awareness campaign and expressed hope that the knowledge shared will be a catalyst for behavior change in communities with regard to vector control.
This year, I was particularly pleased to see the involvement of the students in the camps that will be set up. We underestimate the power of our students, of our school children, in assisting the adults in behavior change. Anyone who has had young kids at home, know when the teacher says something, you have to go home and do it because this is the gospel of what you need to do. So I think this is a very strong strategy in utilizing our students in assisting in getting behavior change at home.
Permanent Secretary in the Ministry of Health, Jenny Daniel, emphasized on the need for multi-sectoral approach to prevent and control vector-borne diseases in St. Lucia. She underscored the campaign as a step in the right direction to ensure community involvement.
As we launch this year's campaign, I want to emphasize that vector control is year-round work. We cannot wait for the rainy season in order to take action. We cannot treat mosquito breeding like someone else's problem, and we cannot afford complacency. Let us build a health-secure St. Lucia, one where clean environments, vigilant communities, and proactive governance come together to stop the spread of disease before it starts.
Minister for Health, the Honorable Moses Jabatis, called for sustained and coordinated action of everyone to effectively control vectors, given the threats that vector-borne diseases pose to health and livelihoods.
This year, we aim to amplify these prevention strategies. Every household, every school, every business, every community group has the power and also the responsibility to act. The success of this campaign rests in the hands of the public. Public participation is not optional, it is essential. Our communities must not only be informed, but also empowered and engaged. Whether you are a parent, a teacher, a shopkeeper, or a student, your involvement counts.
The Environmental Health Division within the Ministry of Health also took the opportunity to acknowledge partners and organizations for their collaboration and contribution towards the vector control efforts. Reporting from the Communications Unit of the Ministry of Health, Wellness and Elderly Affairs, I am Fennel Neptune.